Another important question many women ask is in what position to sleep. Okay, the sleeping positions we have demonstrated in a CD which contains the exercises also, but I can just tell you, in the first 3 months you can lie down in any position you want. You can even lie down in the prone position, and after 3 months don't lie down in the prone position. Prone position is face down like this, and after the 5th month don't lie down completely on the dorsal position. Dorsal position is lying on your back fully facing the ceiling. After the 5th month, what happens? The enlarged uterus can press upon the aorta and reduce the blood supply to the lower part of the body, which also contains the uterus. So once the uterus blood supply is reduced, the baby's blood supply also will be reduced. For this purpose, we ask you not to lie down continuously for a long time in the dorsal position or the back position. But lying down for a few minutes, 10, 15 minutes or 20 minutes doesn't do any harm. In fact, some people can sleep only in the dorsal position comfortably. For these people, what they can do, they can keep a pillow behind the back on one side, make it like a wedge, and that will give you around 15 degrees of tilt. This 15 degrees of tilt will take away the harmful effects of lying down on the dorsal position. At the same time, you have the comfort of lying down with your face up. And when you are lying down, always remember, sit, support your hands, turn to your sides and lie down on the sides. Okay, don't lie down. If you are sitting, don't lie down like this. Okay, turn to your sides, support with your hands and then lie down. These positions are demonstrated in the other CD. And also in the later months of pregnancy, when your tummy is big, when you lie down on your sides, it may be a little dragging. If you are lying down on the left side, this side it may be pulling. So to prevent that, what you can do, you can keep a pillow under the tummy, whichever side you are lying down. And also between the legs, it may be difficult to approximate the legs because of the enlarged tummy. So you can keep a pillow and then keep it separated. Use as many pillows as you want. And some people develop reflux esophagitis, that is, they keep burping. After eating, what happens? The food contents with the gastric juice, which contains hydrochloric acid, keeps coming up, and that produces a lot of irritation. This can be avoided by lying down in the reclining position. You keep 5-6 pillows and then lie down like as you are lying in an easy chair, and don't lie down completely flat. Dear friends, now let's see about some myths and facts about pregnancy. The commonest myth is that when they lie down and when they have to turn, they always have to get up and then turn. Otherwise, the baby's umbilical cord will go around the neck. This is a wrong concept. See, the umbilical cord going around the baby happens because of the baby's movements. Even if you don't do anything, just lie down, if the baby forms a loop and then puts its head into it, it's going to happen without your control. So you really don't have to get up and then turn, and even if you do that, it is not going to prevent it. So while lying down, if you want to turn, you can turn just like that. You don't have to get up. If you keep on getting up in the midnight too many times, you will not be able to sleep. It will be like you are doing an exercise in the night. Okay. Then the other myth is that iron tablets produce black babies, black grapes produce black babies and all that. All this is not true. The color of the baby is determined genetically. It takes after the father, mother, grandfather, grandmother. So it is something hereditary. It is determined by your genes. So you don't have to avoid iron tablets or black grapes to in the fear of get the baby becoming black in color. You can take them. The other myth is the opposite, like if you take saffron, the baby will become pink in color. That is again a myth. I think the reason for the myth is that the saffron was originally from Kashmir. So, people there are very fair, that is because of their environment and genetics. Okay, down south we are exposed to so much of sun, so most of us are black. Even if you take saffron, the baby is not going to be fairer than you. Okay, the fairness depends upon again the genes and not on saffron or any other material, but there is no harm in taking a saffron. A good quality saffron, 1 or 2 threads if you want you can take. It is only a flavoring agent. It neither does good nor does it do any harm. Then the other myth is like if the baby has lot of hair you get epigastric pain. That is also not true. Epigastric pain can occur to anybody. That is because of the increased acidity during pregnancy. And one more myth that is said is like if the baby is a boy, the pregnancy will be prolonged, and if the baby is a girl, it is earlier. That is also not true. There is absolutely no way of finding out from the look of the mother or the size of the abdomen or the date of delivery whether it is going to be a boy or a girl. Now, let us see some of the common disturbances or complaints that happen during pregnancy. This is a very important aspect because many of the times people do not know that these are normal and then they get worried. But even though they are normal, the people around should understand that the person who is suffering from it actually suffers. If she says she has a pain, she does have a pain and suffers from it. If she has a little irritation, it is definitely there is an irritation and she is not acting or exaggerating. The actual suffering is there, but then during pregnancy this sort of little sufferings are quite common. They do not need any treatment by tablets or injections. There are other methods which can be used to treat them. So, the people around should not say the doctor said everything is normal, then why are you complaining like that. You should understand and then you should pacify the pregnant mother. The other thing that you should remember is even though these complaints are common, the line between the normal and abnormal are thin. Certain situations you may be doubtful whether it is really normal or abnormal. If you have any doubts, please call your doctor or go in person, visit the doctor and find out whether it is normal or abnormal. And sometimes the doctor may not be able to tell you over the phone whether it is normal or abnormal unless you present yourself in person. Let us see the common disturbances or the general disturbances that happens during pregnancy. The commonest one is tiredness. The woman feels extremely tired as if somebody has beaten her. She will be feeling very tired and wants to sleep all the time. In the early months of pregnancy, increased sleepiness is very common, whereas in the later months of pregnancy, sleeplessness is more common. And this tiredness, we really cannot do anything, like we cannot give medicines and boost up her energy like that. This is part and parcel of normal pregnancy, especially in the first 3 months till about 12 to 14 weeks. Many of them will feel giddy, like they cannot stand for more than 5 to 10 minutes, especially in a crowded place where it is sweating a lot. So, when you are standing for a bus or doing some cooking, do not stand still for a long time for more than 5 minutes. You can walk, you can take some steps, you can do on the spot walking. All these things will help you to prevent from fainting. When you stand for a long time, for more than 5 minutes, the tendency to faint is more. That is mainly because of the hormonal changes that happen during the pregnancy, the blood gets pooled in the lower limbs. When you do walking or on the spot walking, then the blood gets pumped back by the muscles to the heart. But when you do not move, if you stand still, the muscle does not pump the blood back into the heart and most of the blood gets pooled in the lower limbs and the supply to the brain and the heart becomes less and you faint. This fainting is harmless, but if you are standing in a place which is very dangerous, say you are standing in the middle of the road or near stove, that is a dangerous thing. So, whenever you feel like fainting, whether it is a road or anything, you should call for help and just sit down and have something to drink, you will be fine. And most of these patients do have a lowering of the BP. You should remember that the persons in the first 3 months of pregnancy will have a low BP. This is actually a good thing. Most of these women who develop low BP around 90-60 around this time, that is the 3rd month, usually do not develop a high BP in the later months of pregnancy. So, when the woman has a low BP, we are quite happy, oh, this woman will not have high BP later, like that. But the disadvantage with the low BP is the woman may faint easily if she sweats a lot or if she does not drink enough fluid, because of the vomiting, the woman may not be able to take adequate fluids, and that leads to a much more lower BP, which makes her faint. These women should always have a little salted drinks with them, and whenever they feel like fainting, they should drink a little of this salted drink and then sit down wherever they are and call for help. This symptom will clear in about a minute or two, so you really don't have to worry. The other common symptoms that happen during pregnancy in the first 3 months is vomiting.